Hey everybody, I am making you a video with some OB tips. I'm going to be doing a few of these. Today's video is going to be OB tips on starting an exam, which seems pretty obvious on what you need to do, but there are little things that you need to be aware of to make sure that we are charging the patient for the correct exam for insurance purposes and to make sure that we are getting the correct patient information entered, and just, a few little extra things that you may or may not know about. So here we go. OB tips part 1. First thing we're going to do is look up your patient in Synapse, which seems easy enough, but we need to look up that patient in 3 separate areas to make sure that we are charging them for the correct study. If they have already had a greater than, we cannot charge them for any more. And if they have never had any exams ever in the past and they are greater than 14 weeks, it needs to be a preg limited. I will get into that later, but for now I will just show you where you need to look for these exams. So under Synapse, you need to search in these 3 different areas. So I have Synapse pulled up over here. So I just opened the main Synapse. You can see up here. And this is the one that we normally go in. This is Northern Colorado Medical Center, East Morgan County Hospital in Banner Fort Collins. You also need to be searching in this folder here, which, if you are not already aware, that is McKee Medical Center. So if a patient says they had a study done at McKee, you can find it there for anything, not just OB. Also, sometimes the patients have a study done at their doctor's office or somewhere else, and that may or may not show up under Banner Medical Group and Arizona region. There are other ways to get into Banner Medical Group, but this is the easiest, and it'll show all of the Banner Medical Group facilities if any study's been done. So that's easy enough. All right, this will help you choose the right exam to do, which we will move on to next. Choosing the exam type. Now, if the patient is only getting a preg transvag for a cervical length or for a first trimester OB, if that is all they want, or if you just can't see jack squat on top of the tummy, and you choose to only do a preg transvaginal, then they will not get charged for less than. They will only get charged for a preg transvaginal. However, if you are taking any images on top of the tummy other than a heart rate, you have to add a preg limited, do the exam as a preg limited, and add a preg transvag charge at the end in the billables. If your patient is less than 14 weeks, you will charge a preg less than 14 weeks. Okay, that's pretty obvious. You can do more than one of these. You can do as many of these as they order in a pregnancy. So there is no limit. However, if you have to do transvaginal imaging as well, and you do both, then you must add a preg transvaginal charge at the end in the billables. If your patient is greater than 14 weeks, it gets a little more tricky. If the patient is 19 weeks or more, we put the limit at 19 weeks for a full fetal survey, just because we have difficult patients, and there's a lot of patients when you do them earlier than that that will need additional images, and this just helps reduce it a little bit. So if they're 19 weeks or more and you are attempting to do a full fetal survey, you will charge a preg greater than or equal to 14 weeks. If you are not attempting to do a full fetal survey, do not use this charge. You cannot use this charge if it's been used at all at any of those 3 facilities, 4 facilities, but any of those 3 places that we checked. It can only be used once. And if they say they've had it done at their doctor's office as well, you will not do this exam either, because they've already had it done and it's already been submitted to their insurance. So it can only be done once during a pregnancy. Some doctors put on their order repeat fetal survey. We don't repeat fetal surveys. Every once in a while, you get a patient who was just too difficult, too big, and we couldn't see jack squat. So you may end up having to redo pretty much all of it, but you cannot charge for another fetal survey. It's going to be a preg re-eval, even if we are pretty much redoing it. If your patient is between 14 weeks and delivery, so anything greater than 14 weeks, and you are doing any type of growth measurements, you will charge a preg re-eval. The only exception is if they have never had any images at any of our facilities. If you look and there is nothing under any of those tabs, then we have to do a preg limited, because we can't re-eval something that we've never evaluated in the first place. Now, if they've never had anything done with us before and you are attempting a fetal survey, you can use the preg greater than or equal to. That is fine. If we need additional images of anything that was not seen on a fetal survey, even if it's just a few pictures like nose and lips or profile, that's a preg re-eval. We're re-evaluating that fetus. If we are following any abnormality that was previously seen, we're re-evaluating as well. So that is a preg re-eval. A preg limited is only used for a viability check in which you do not perform measurements. So just a quick, is the baby okay? Is the baby alive? Is the placenta coming, hemorrhaging, or anything like that? You can check the presentation, the placenta for previa, transabdominal cervix, and or an AFI or max vertical pocket with this preg limited. But if it's something more involved, then you really should do a preg re-eval. A preg complete should only ever be used on high-risk OB days when the patient sees Dr. Harper after their visit. If you do not do high-risk OB, do not use this charge. Fetal umbilical artery Doppler should be done on any baby that is under the 10th percentile estimated fetal weight after 24 weeks. That's when they start considering IUGR. It can't be added on the end as a billable, so you have to add it as an extra exam. So we do the Dopplers. If we see that it's under the 10th percent, we do it at the end of the exam, and then we go into Cerner and add on the fetal umbilical artery Doppler. And then we take a screenshot under the umbilical exam saying that the images are with whatever study we did done the same day. If they order an umbilical Doppler for you to do, and they want anything else with it, like umbilical Doppler with AFI, a lot of times they want. Or if they want growth as well, then it'll either be a preg limited or a preg re-eval that you will have to charge along with the umbilical Doppler. Again, that's two separate exams. This is confusing for a lot of people. How do you choose the right EDD? If you're doing a patient for the first time and they are not 100% sure of their LMP, if they're just guessing, or their doctor's just guessing, or anywhere it says unsure LMP, or they give you a couple different dates, don't put anything into the system. Do not use an LMP. An inaccurate date can skew their future care, which we'll get to in the next slide. Always check their priors. Never ask the patient unless you have nothing else to go by. They're usually wrong. They'll give you all sorts of crazy dates. I've had people give me 4 different dates. They're like, oh, well, this person said this and this person said that. And it's just better to use the hard evidence that we have unless we have nothing to go by. So when you're choosing the correct EDD, you will always use the very first ultrasound in which a fetal pole can be visualized. Ignore the other exams because people might not have put in the correct dates. So are we going by the LMP or the adjusted ultrasound age? So this is why it's important to only use accurate dates, because if we guess and we're just shy of changing the estimated due date, the baby will appear huge, or more often and more concerning, tiny the entire pregnancy, when really the dates were just incorrect. So I know this chart is hard for some people to read. So an example I have here is if a baby's measuring 7 weeks by our first ultrasound, and the LMP is 5 days different, you keep using the LMP. You don't use the date you got from the ultrasound. If the LMP is 6 days different, that's greater than 5 days. At that point, we switch to using the adjusted ultrasound age, and you will use that throughout the whole pregnancy, unless, you know, a doctor tells you otherwise. But that's pretty much what we do, and unless rare situations arise. So this only applies to the first ultrasound. That's why it's important to refer back to the first ultrasound when figuring out an EDD. And you see, the further along the patient is when we do their first ultrasound, the bigger the gap from the LMP can be. So that's why we don't want to put an inaccurate LMP in there. If you guys have questions about this, feel free to call me, and I can try and help explain more, but it can be a little confusing. So, yay! We're all ready to start scanning a patient, and hopefully I'm going to be giving you more information regarding, you know, further into the exam here to come in the future. All right, happy scanning.